sure individuals are at least educating themselves to make sure that all is well. But thank you for this moment.
You're welcome, and thank you, Charles, for all that you're doing to help with this initiative. And Leon, if you want to give us an update on how things are going at the city.
Sure. We're settling into the, I guess, the new norm, whatever that is. People wearing masks, staying away from each other. Kind of interesting, but I think that's actually, you just see that now, and that's pretty much the way I guess things are going to be for the immediate future. I do want to talk about the CARES funding. Tim mentioned that. I'll elaborate a little bit on the city. We've been, we set aside a pot of the money that we got to help small businesses. We initially set aside $250,000. We've been getting applications. We review them twice a week. Right now, we've approved, I want to say about 80. We just met today, and we're probably pushing close to $300,000 in small business grants that we've given away so far. We're going to extend this through the end of July, and then see where we are. And if we continue to get interest, we'll look at extending that if need be. But at least at the moment, we've exceeded the pot of money that we set aside, but we're going to continue through the end of July. We have made some awards to some nonprofits, particularly nonprofits that provide services to the community type services. So we have done that. And again, our deadline is July 31. So we are going to review applications through the end of July and just see where we are at that point. We follow on another piece. We followed the lead of a lot of other communities and suspended utility disconnects through the end of August for people that cannot pay utilities. We've waived late fees. My guess is beginning at the end of August, we will, unless something drastic changes, we probably will resume disconnections on utilities for delinquent accounts. And the way to get around that is if people are delinquent on their accounts, they have to meet or contact our utility billing office and set up a payment plan to get caught up. I reviewed the utility list several days ago, and I'm real sad to say there are some folks in the community that are really digging some deep holes for themselves on delinquent utility payments. And that's something we're going to have to work through, but my guess is it'll continue through the end of August, and quite likely beginning in September, we'll have to resume that. I guess a few other things. As some of you or most of you know, the city has a program where we issue special events, a permit for a special event like a parade or a community type event. When Virginia went to phase 3 and kind of slackened the requirements a bit, we resumed issuing special event or permits for special events, and then immediately had to backtrack on that because a few permits that we issued, we realized that those events, there was no way to control public access. So we ended up with an event or two where just people had intended on 30 or 40 or 50 people coming, and all of a sudden it was 300 people, and there's no way to keep people separated and people without masks. So we immediately had to backtrack on that, and at least for the time being, we have suspended issuing any permits for special events in the city until conditions change, which my guess will probably go into the fall and maybe even into next year. Kind of interestingly, one other thing that we did that we've since backed off of is shortly before July 4th, we ended up with, employees wanting to go to the beach and asking questions about what do they do when they go to a hot spot like Myrtle Beach and return to work. So we had some conversation and ended up putting a policy in place where if our employees, if you went someplace like that, when you came back, you either had to have a negative test or you had to self-quarantine for 14 days. And that was pretty drastic, and we heard an awful lot from our employees. Surprisingly, out of that policy, we ended up with at least 3 or 4 or 5 situations where employees came back, they were self-quarantining, and in the middle of that process found out they had symptoms. So it prevented those folks from coming back into our workforce. Given the fact now that if you've looked at the latest map, Virginia and South Carolina and North Carolina, and for that, pretty much all of the South and Southeastern United States, everything is now a hotspot. So there's really just about nowhere you can go where you can't legitimately say you're going to a hotspot. So we've backed off of that policy. We no longer are requiring that, but we're just asking people, if you travel somewhere and it's a known hotspot, do the things that Tim mentioned, the common sense things: wear your mask, social distance, wash your hands, keep your hands away from your face, do all those kinds of things, and just kind of self-monitor. So we've backed off of that. But kind of interestingly, we had a period where we had 3 or 4 employees that had returned from places like that did contact or contract the virus. So I guess there was some good that came out of that. It was a lot of inconvenience to our employees, but just a lot of kind of odds and ends, things like that. Our public meetings, our council meetings, we've tried to do things that would lessen the need for the public to attend meetings. We're doing as much as we can by electronic means, video, Zoom meetings. We're trying to make it easier for people if we have a public hearing issue to comment so that they don't have to come to a meeting. My guess is that will continue into the future as the new norm. So it's kind of a changing landscape. We're trying to adapt. I think the things at the Mustangs games are going fairly well. I think obviously as you go to events like that, it's clear that people are still very reluctant, or in some cases people are not as excited to get out in the public and get close to people. So I think that's probably going to continue at least through the fall and maybe even to the first part of next year, at whatever point some type of a vaccine ends up being developed. So just kind of keeping up with that and trying to adapt as the conditions change. So that's pretty much where we are.
Thank you, Leon. We appreciate that update from the city. And Dale, I'll move on. Let's see. There we go.
Unmuted. Good?
You're
Can you hear
good.
me?
Yes.
All right. All righty. So a couple updates for us. We are pleased to announce that we have selected and appointed a chief medical officer for our system, the Silver Health system. Obviously, both hospitals, Danville and Martinsville. So the chief medical officer is, for lack of a better way to put it, I'll just call this person a chief quality officer. So really they're focused on making sure our patient safety, patient quality of care, preventable harms, readmissions, all the kinds of things that we track for good quality, high quality care. The chief medical officer is in charge of that and kind of leads that. We have a quality office. We've always had that. We've been looking for a chief medical officer for a few months now. So Dr. Sharanda Gunn-Nolan is our chief medical officer that's been selected. She's been working at Danville for the past several years as an inpatient doctor, which is a hospitalist. So she will make a great addition to our senior executive team. And she'll be the bridge, if you will, for executive management and the senior team, both CEOs and the medical staff. So we're really, really pleased to have her on board. She will be working at both facilities, so she's going to split her time at both hospitals throughout the month. So she will drive quality, and we're expecting great things with her being appointed in this new role. So we're very happy. And there's going to be, I think, a media announcement coming out here in the next few days. We sent it out. We sent it out yesterday on the forum. So that's on the wire. So we're very happy to announce that. Also, we've started a new initiative called a physician-led COVID update, which is going to be a series that we do every couple of weeks. This will be done by a physician. Dr. Gunn-Nolan did the one for this week. Basically, it's going to be an update from a doc. It'll be posted to our hospital COVID-19 webpage, preparedness webpage, and Facebook. So that's something that anybody can go look at on a biweekly basis every other week and take a look. And there may be a tidbit in there or something we're talking about from a quality perspective. Basically, it'll be a constant update between the two hospitals, general things that might be going on between the two hospitals and in the markets related to COVID. So hopefully that'll be helpful as an educational tool for our community. Also wanted to just remind folks, we a few weeks ago, I guess now, we had pulled back on our visitation policy with visitors. Since early July, we have kind of opened that back up a little bit from the perspective of we're allowing one well visitor for limited units, which is our telemetry unit, which is our fifth floor rather, our medical surgical unit, outpatient surgery areas, and then our ancillary service areas. So that's one well visitor now. That's subject to be pulled back, obviously, based on risk. COVID continues to climb, and we see any correlation with a problem with the visitation policy. And we have challenges in-house. We want to make sure we keep people safe and patients safe. But we have been doing that, so that's been well received. But I just have a disclaimer is, we may have to pull back on that at any time, given anything that we think is risky in the community that we want to make sure we limit our in-house access, if you will. But we're happy to do that. I think, visitation is part of the healing process for our patients. And it's very challenging, obviously, if you've ever been an inpatient, to be in the hospital to begin with, let alone not be able to have a loved one there. So anything we can do to help that, we're absolutely going to do it. One huge caveat that we will enforce in this hospital and at Danville, if we have a visitor, you absolutely will have a mask on or you will not be able to stay. Anybody in this hospital, doc, staff member, employee, executive, patient, visitor has to have a mask on. We're in the facility. Now, the one caveat would be an inpatient that's in their room by themselves. Obviously, they don't need to be masked up if they're by themselves. But if a visitor comes in or our nursing staff comes in or the docs, we ask everybody to do that, put a mask on, and to echo the comments that have been made earlier. That mask-to-mask situation is an absolute protection measure that we really can't really overstate it. For us, we are also doing what's called a face shield for all of our staff that are dealing with patients. That's an extra layer of protection. Obviously, everybody in the community can't walk around with a face shield on. We'd all look like Darth Vader, but we do have face shields that all our staff will be wearing. So if you're a patient in this hospital or a visitor, our folks will have a mask on and a face shield. That protects everything on the front, if you will, all the access points that typically COVID accesses for our folks dealing with patients one-on-one and or in situations where we have folks that are dealing with visitors as well. So that's kind of a change that we've done over the past couple of weeks as well. We have had, and I think Sharon's probably going to mention a rise in numbers. We have had a little bit of an increase in COVID in the hospital here over the past month or 6 weeks, I guess. But what I will tell you is we haven't hit, like this week, for instance, it's kind of averaged out and tapered off. So we're not hitting extreme numbers, but it has ticked up a little bit. I will tell you that our vent management, which is something you hear in the news a lot on patients working or being put on vents, that's been minimal, thankfully. So that means that some of our patients, are less acute than some others, obviously. So the vent management piece has been very, very manageable. Our COVID unit is doing well. Our patients there are doing well and recovering. Our staff are doing well there. I think everything we're doing, frankly, has worked so far as far as protecting patients, staff, and anybody coming into the building. So we're going to keep doing what we're doing. There is an indication that numbers are going up in the county. Martinsville, as the Department of Health will talk about. So that's something we really, as a community, have to be cognizant of. And I'm absolutely telling you right now, the three things that were mentioned earlier, mask, hand washing, and 6 feet, those things are so important, not just to get back to normal, but to help save lives. It really, really, really does hit home. So all it takes is one time, one person that's vulnerable. And if that's your family member, that makes a world of difference to you if it happened to your family member. So I would just ask that we all follow those guidelines. And absolutely does not hurt anybody, right? It does help people, though. it does save lives. So with that, I'll hand off to the next person, and I appreciate your time.
Okay, thank you very much, Dale. We are going to move on to Nancy with the Virginia Health Department, our West Piedmont region. So Nancy, thank you for joining us.
I'm always the bearer of bad news.
So we're going to put you at the end of the day, huh?
As of today, Martinsville and Henry County alone have had 580 positive cases of COVID, which is about a rate of about 828 per 100,000, which is higher than state average. That's Henry County. Martinsville is 1,139 per 100,000. So we're above state averages on our numbers of cases per population. And we've had 6 deaths, which are 6 too many in Martinsville, Henry County. Right now, we are working with more than one long-term care facility that's having an outbreak. And as you know, people who are in long-term care facilities are completely at risk. And that's why we get so many in the hospital in these waves, because usually it's older people. I know it's that way here in Franklin County. So, you know, what are we doing about it? We're preaching the wear the mask, distance yourself message, just like everyone else. But we do work with community groups who want to do testing. I think the way we're all looking at it now, we barely have the capacity to deal with on the back end. For instance, we have 138 active cases right now. That's 138 people who have to be called every day, as do their contacts. We check on them to see if they're developing any symptoms. It's a lot of phone calls. And that's why the press are getting kind of annoyed with me, because I can't get right back with an answer, because I can't get my people to pick up the phone because they don't have time. So it's slowing the whole process down. We have been hiring contact tracers, and the state is now allowing us to turn some of our contact tracers into case managers. And the distinction is that the contact tracer basically calls the contacts that have been identified, gives them instructions, and talks to them about symptoms and what to do if they feel ill. The case managers manage all of that. They talk to the person who's tested positive. They work with physicians. They may pull in some community services to assist with various aspects. And it's a little more involved. But we are hiring them as fast as we can get them, and the state is giving us the money because we're a high need area right now, which is a distinction we don't want. We have also seen an uptick in citizen complaints about businesses where they're not enforcing mask wearing. Thankfully, we don't deal with that on a local level. There's actually a complaint form on the VDH COVID website where it's just a simple 5-question survey. You know, who is it? What's their address? Describe what you saw. And for instance, in Franklin County this past weekend, we received pictures from a race at Franklin County Speedway where people were mashed into the stands. No one had on a mask. And we had citizen complaints. They actually took pictures and sent them to us, which always begs the question, what are you going to do about it? And locally, we're going to be concerned. We're going to call them. We're going to advise them that that is a really bad idea. The companies and businesses that you're being watched, people are complaining. But other than that, even though we are charged with enforcement, we're not enforcing. We don't have the teeth and we don't have the time to get in there with all of these situations. It's widespread, and we're seeing fewer and fewer people wear masks, and it's very alarming. So that mask up MHC message has got to stay strong. Schools are getting ready to start, and we've had a lot of calls from parents, from teachers, from superintendents of school, asking us to help interpret the governor's guidelines and the CDC guidelines. And you know, that is a job none of us wants right now, trying to decide how safely to educate the children of your community. And there are lots of factors. And as you've seen, some school systems have made a decision that's already been changed before school has even started. So I think we all need to keep an eye on that and to provide whatever support we can to our colleagues in education. They're charged with educating our children, but we have to make it as safe for them as we can as well. So cases are still going up. We're having citizen complaints, and school's about to start. And I think that's a perfectly horrible place to be.
Thank you, Nancy. And I guess we'll open up for media to ask questions now. And again, I want to thank our media for participating because, you know, without you guys, it would be really tough for us to get all this information out. So Charles Rourke, we'll start with you. Who do you have a question for?
I'd like to talk to Nancy at first. And of course, Nancy, I mean, I know you'll be a former news person. What's the headline that we need to be saying in our publications and media and so forth about what's going on right now?
The virus is winning.
Wow.
And it doesn't have to.
So you think as a community we're not doing good enough at this? We're not.
We're not. I spend time driving around and looking in retail stores and so forth, and less than 30% of the customers, in my view, that's an estimate, are wearing masks, and sometimes the staff have them pulled down below their nose. And I mean, they've got to take it seriously. If we don't take it seriously, we're not going to get our lives back. Right
now, and I want to ask Tim and Leon the next question, because I'm trying to figure out how our community is, that it's so, people have to work in our community because of the economy and so forth. How do we expect to run our community with parents that can't go to work because they're gonna have to look after their kids and things like that? I mean, I just see that the fall of this could be a catastrophe for us.
I'll go first. I'm thankful that was not my decision to make. I watched all the polling that was done, both by the media folks and some other things, and it looked like there were three options on the polls that I saw: all virtual, a hybrid, or all back in the classroom. And they all were virtually a third popular. So whatever decision is made, you're going to irritate 2/3 of your population. There is no good answer. But the good answer, and to Nancy's point, Nancy, that's an excellent headline. She went in the Wayback Machine to get that media expertise there. But the virus is winning because we're letting it win. We're not doing everything that we can do to beat it. And this place will not be back to what it needs to be educationally, socially, economically, until we win. And the way we win is those three simple little things. And to Nancy's point, I was in a store early Monday morning before I came to work. And I followed a young man into the door. He did not have a mask on. And when I say young, everybody's young to me, but I would say he was probably mid to young 20s. And he did not have a mask on. And he stopped as I was coming in and looked at me and grinned as if he hoped I would confront him about this. This is not a macho thing. This is not, we get advocating for masks, we're called sheep. If you read 23rd Psalm, we're all sheep, and I'm glad to be in that category. But just put the dang thing on. Put it on. And if it bothers you, then maybe not go out. But we can't allow this to go on, because there is an ever escalating impact as these test results go up, as the thing begins to spread even more than it has already, and it reaches down to every level of our society. And Charles, to your question, I don't know how we fix any of this other than doing those three little things and seeing if that works.
All right, but I'm actually, the real issue, parents and that have to go to work, I just don't see how this is going to work for a lot of these folks.
And it may not. So we need those parents to advocate for doing it the right way. Talk to the people that you see not doing it the right way. It's going to be very painful. My wife's a teacher, and she hadn't slept for weeks trying to figure out how to best do what she's going to be expected to do. There is no good answer. it's going to have a monumental negative impact on education, on the business community, on any semblance of a normal rollout here. It's going to impact everybody. There is no simple answer, unless you want to do the three things, and hopefully that works. But to answer your question, I can't answer that because there's no good answer. It's going to have a serious detrimental impact on every level of our society if we don't start doing what we're supposed to do.
Leon?
Yeah, I will add to that. You know, if I don't know the answer to something, I'm not ashamed to say that I don't know. And in this case, I really don't know how to answer that question. I know here at our facility and our operation, you know, wherever we can, we allow people to work from home. And I understand that if parents have to stay home with kids, a lot of that's going to come into play. There's a whole lot of operations and employment in our community where that is not an option. You can't, if you work for a local industry and you're running machinery and equipment, you can't work from home, obviously. So for many people, that is just simply not an option. So I don't know. I think as a community, when all this started, I think we were doing okay, but then we got to, Memorial Day, and a lot of people are hearing that, and everybody seemed to have the idea that we were over the hump. Virginia started, lessening the restrictions, and I think people thought that all this was in the rearview mirror, and then it's come back to bite us big time. And I thought, again, back to the basics that Tim's reiterated, we got to keep doing those things. I see more and more people wearing masks, but I still go into stores and restaurants, and you see people that aren't, and you can look at them and they look at you, you got one on, they don't have one on, and they just got the attitude that, hey, I'm not putting one on. I don't care what happens. I don't know how we get around that kind of thing, but all we can do is you keep wearing your mask, you keep distancing, you wash your hands, and sooner or later, hopefully everybody gets the message, and as a community, we can move beyond where we are.
All right. Okay. Bill, do you have any questions for anyone?
Yeah, can you hear me?
Yes.
Okay. At the beginning of this, we were talking about the mask initiatives, and I apologize. It's kind of an ignorant question. I haven't seen the videos, but is this initiative to educate people that they should be wearing their masks, or is there a provision for people who don't have them for whatever reason to obtain them? And I don't know who to address the question to, so whoever has the answer.
I'll start, and then somebody else can jump in. It is an educational initiative. We do have masks available for the general public if they want one. And perhaps Carly or India can outline to whom they've distributed those. I know we have some here at the county administration building, and I know several folks who participated in the various videos. Now, the way I approached it was, I'm going to wear this mask for somebody. And I specifically said, for the people who work in local government, I'm wearing it for you. Maybe the message should have been, wear it for yourself. I don't know. Maybe we should have put it as starkly as possible. But as I approached it, and from looking at the videos, a lot of folks are saying, I'm wearing this for someone else or for a cause, to try to make it about more than ourselves. And, I'm a firm believer that that's why we're here. It's not about us. But Carly or India, if y'all want to talk about anything else, feel free to jump in.
Yeah, it definitely started out as educating people that it is really important for people to wear their masks. Like Tim said, we did distribute masks to the city, the county, VDH, the hospital, and the coalition. Each of those entities are able to distribute the masks however they like, but we did ask that they distributed to people who really needed them in whatever manner they chose. So we're really excited about those.
Great. Okay. A couple more questions, and this would be for Leon and Tim. With the CARES money that you've been distributing, most people are being approved, some are not. For people out there that maybe haven't applied and are thinking, we really ought to do this, can you tell us what the most common reasons for being turned down are? Maybe the top 2 or 3.
Yeah, I'll jump in. That's pretty easy for us because we've gone through so many applications. We get a lot, our grant window was $5,000, and we get a lot of applications where people just put down, we want $5,000, and they provide no supporting information at all. We need some specifics about what that money is going to be used for. Obviously things like hand sanitizer and the sneeze guards that they're now called, protective equipment, cleaning supplies, things like that. Those are, easy things to approve. We're having a heck of a thunderstorm here right now, so if I get cut off, kind of bear with me. But those are things that are easy to approve. But we get a number of applications that just are, for lack of a better description, are incomplete applications, and we have to circle back with people and ask for additional information. And sometimes we have to do that 2 or 3 times to get detailed information. But we're helping with, if businesses were shut down for like a 3-month period, March.